Well, it's such a beautiful day wherever you're watching us from. I believe that the fact that you're listening to this voice and you're watching this image, I have a reason to thank the Almighty God for what He has taken you through and where He has brought you from. This is Family Hour. Adrian Austin Makalazi is my name. It's a why am I thinking about Friday this early? It's a Tuesday, and of course, every Tuesday we are here to discuss health. And today we are still discussing health. We know that children are back to school, and because they're in school, it's also important. There is one aspect that very many parents and schools don't pay attention to. Of course, they'll give you a medical form, and they'll tell you to take them to they'll ask for specific things like ulcers, diabetes, hypertension, and a few schools would really acknowledge the need for dental health. And it's the reason we keep coming here to discuss this. Now, before I introduce this topic in detail, and of course I guess today, a few months ago I was struggling with my teeth. And I think if you noticed, my smile was somehow fading. And so one time I stepped into a facility called Victory Medical Center, somewhere in Katale, on one fateful evening. And I came out smiling. And of course, while I was smiling, I realized that the person I met there is a person who had hosted on this platform for some time, and he had hid himself there in Katale. Now, today, we are glad we have him again with us. Talk about some of these issues. And of course, with us is Talemwa Edwin. Edwin, it's a pleasure having you with us this evening.
It's a pleasure to having you, Mr. Edwin.
We wonder why you had disappeared from Family Hour for quite some time.
I think it's just because of busy schedules.
Okay.
Yeah.
Others, have you been?
I've not been bad. Okay. How are you doing? How is family?
We are here pushing on. We thank God for the grace. And today we want to look at, we want to demystify some of the common myths associated with dental health. And of course, so that is our topic of discussion. But I'll just first of all let you greet our viewer, and then we shall continue with our topic.
Oh, thank you so much. Our dear viewers, I greet you once again this evening. Good evening to you all. I want to repeat the name. Okay, I'm Talemwa Edwin. You normally call me, say Edwin from Rafa, Edwin, now you're saying from Victory, but I normally prefer, I'm a public health dentist. Okay. Public health, public for all. Oral health, okay. We are in a campaign of oral health promotion.
But where you find is where you are.
Exactly. We are just trying to bring out that oral health awareness. Okay. And this one is not limited to anyone, whether you're located, well, that's why you normally find us having those campaigns in those camps in villages where, so I don't normally prefer calling myself maybe a station dentist. I'm just there for your oral health, someone's oral health there, but then it's a wonderful topic today that we are going to really bring out those myths concerning our oral health. I think we are just yet to have another important discussion.
Exactly. And just to start with, talking about myths, there are things that I want us to start with. We have people out when you take, for example, Benichwanka Street. I believe now that they are putting street vendors off street. Such people will also be off streets who tell you, I have this liquid. When you use it to rinse your mouth and you spit, you'll even see, I don't know that it is an insect or whatever that has been in your teeth. You'll spit it and see it. So we want to understand, you tell us that we have, for lack of a better word, I'll say, Chiwuka Mourinho. What is that thing that people reach an extent of telling people that when you rinse your mouth with this particular liquid, you'll even see it physically there.
But then before that, for our dear viewers out there, I wanted us to first bring out, we are talking about the topic is myth.
Yes,
but do they know what a myth is? I wanted us to first have that brief introduction of our tonight's topic.
It's fine.
Our dear viewers, what we are calling about a myth, it is something that is widely held false belief. It's a widely held false belief. But in most cases, it is based on misinformation.
Okay.
You get? Those are the key things I wanted us to understand. Widely held, which means it is the biggest population. It's what it knows, but then it is baseless. It's based on misinformation. Okay. So tonight, there are many myths around the world, or different concerning different things. But tonight, it's a very important discussion, our dear viewers out there, that we are yet to know about. What are those things that we falsely believe? Because now we understand that a myth is something that we falsely believe.
Yes.
And again, it's widely false believed. So before even going into I think it was very important for us to understand what are we yet to discuss about. There are quite several and quite very many. I wanted us to basically base on those of mostly the dental importance of, because what our viewers are just yet to listen to are what they have been calling right, but in actual sense, as I told you,
it's wrong.
It is based on misinformation.
Okay.
Even by the end of this show, this program, we are going to find out that actually what we have been bringing, that it's true, mostly in our oral cavity, it's actually wrong.
Okay.
You said kids are already at school. Maybe this will benefit the parents or the teachers who are viewing this program.
Yeah.
Really, I wanted to start with it because I found it a very common question whenever I get patients visiting the dental clinic.
Okay.
That is the first myth called, whereby people tend to say that, why do I need to care about my child's teeth since they eventually get out, the so-called milk teeth?
Okay.
That's a belief that I feel it's a false belief that is widely spread within our communities. But then, you yourself, you would also ask yourself, why would I try to clean the teeth of my child? My child is eventually they will again come out, because we all know that milk teeth are the first set of teeth that come in the child's mouth. But then you find that people don't take it as a point to clean them. Why do we need to clean them?
Do they even know why they should clean them?
That's why we are here, most importantly. Okay. Because we realize why it is necessary to clean our children's teeth. These milk teeth are the most important teeth, even more than the permanent ones.
Okay.
Why do I say so? Mr. Edwin, you find that the permanent teeth, what keeps their place, like why for you eventually develop those permanent teeth you have, you develop them, they are in good line, they are in good shape. Reason being, the milk teeth, when they reach the time of shedding, we might call it shedding off, they are trying, you shake them, they eventually get them out. Yes. It means that...
And the rat gives you money.
The rat gives you money. That's the fun bit of it. But then, you find that they are the teeth that keep the position they keep the position of the other permanent teeth that are coming. What do I mean? Like, if you remove those teeth earlier enough, because what I'm trying to bring out in regard to this myth, that people tend not to care for those teeth. When you tend not to care, it means they will get sick eventually. Yeah. We all know about this. We have all heard about dental caries or tooth decay. A tooth decay is when you don't care about it or you don't care for it. So in this regard, I'm taking it like you didn't care for those milk teeth, and maybe you lost them before the time of shedding off. So now, let's understand the role of those milk teeth. Milk teeth are when the permanent tooth is coming, it lacks orientation when there is absence of that milk tooth. They gain orientation following the other milk tooth that was there. So by the time you maybe, for us, we used to do it ourselves at home. A milk tooth starts to shake, you pull it out easily without even paying.
It was always exciting. I wonder what the rats picked.
No, I think that was just maybe like a motivation.
Us money.
Yeah, but then if you find that if you don't care for that tooth, you are going to lose it. But now let's look at just few demerits of when you have lost it.
Yeah.
When you have lost it, have you ever seen someone who maybe develops teeth when they are facing in a wrong side, or bigger in size. It means just little. It means that the teeth lacked orientation. Why? Because the teeth that they were supposed to replace, for them they were lost a long time ago. Maybe due to these dental caries, the tooth decay we are talking about. So you find that
in the same development, there is also something that people out there might be wondering. For example, still talking about the size. Someone, for example, had a very small milk teeth, and then in replacement, they are bigger. Or maybe the milk teeth was bigger in size, and then in replacement, the permanent is smaller. What causes that?
And now, like the arrangement or the teething process, where you develop a milk tooth, maybe I can give an example, maybe a premolar. You are most likely to find that a permanent tooth that is coming is a molar, and they differ in sizes. So it's not a must that where you had a premolar, maybe slightly smaller than a molar tooth, that you must develop a molar tooth. I mean, the same premolar tooth. So it is just because you understand, you have 32 teeth, but then the milk teeth are 20 in number. So you realize they cannot fit in that same position. There must be some alterations. I think that's one of the first myths I felt like we should bring out.
And very important.
There another because tonight I try to bring out those things that people have been trying to say out. There's another thing that is coming on, which is like I want to develop white teeth, or the community believes.
Before we get to the white teeth, there are people who strongly don't believe in what are they called? False teeth.
False teeth. I have it on.
There's a community that still believes that those should be removed by those traditionalists.
Traditional dentists.
Traditional dentists, they're dentists anyway.
Yeah.
And so there is no amount of explanation you're going to give them about the false teeth being a tooth, because in the first place, why is it false anyway?
Anyway. You see, when we are beginning this particular show, I thought these are widely held false beliefs. So you are already bringing it that they are called false teeth, evinyo. Our dear viewers out there, these are the so-called evinyo. In Onyanko, they call them evino. Here they call them, you can call them false teeth. But then in fact, for it is bringing itself now. But most cases, those traditional dentists, they don't love to hear this because we are causing unemployment down there on ground. Because those people, they extract 10,000, 20K, they remove those. But let's now understand, in fact, it's the most dangerous procedure you can ever have. I wanted to ask you or pose a question to our dear viewers. Who of you, who amongst you has ever witnessed that? If you have ever, I managed to witness one, but the experience was totally the worst. In reason being, I realized those people, there's what we call septic techniques or septic measures. Septic measures, like you are trying to cause more good than harm. Yes, you are removing the tooth of a patient, if at all it's right. But then what are you using to remove? Are you clean enough? Are you sterile enough? I realized someone had, was it like a nail but carved in a certain way that it can remove a tooth. Then in bare hands and clean hands, in fact, if you are to, dear viewers, those milk teeth, they don't remove them from old people. We are dealing with kids.
Yes.
Someone is born, 1 month down the road, this person is having a venue. What do they consider? The first clinical signs they consider that this person is having a venue. Actually, we have a child maybe starts to cry, a child dilates, a child maybe loses appetite. Maybe for those who are medics or what, you realize that those are the first clinical signs of an infection in a child. But take a look, you have got an infection, but then you have been misguided. That's why I told you that this is based on misinformation. Maybe most of them are following traditions. It's a traditional belief. But then, how do they come about? at least I want us to understand, at least this one I would dwell much onto it than other briefs, so that we can really try to bring it out clearly. Because you realize, as a child, there's a process of teething, or the child is trying to develop the teeth. This process started when the child was within the mother's womb. Yeah. But then the child is finally born, but the process is just continuous. So in that process of developing the teeth, this child of ours, for you, people might ask me, that child is too young. What? Eh? But then, for them, they believe that child cannot develop teeth. Yeah. But then eventually when someone goes there, they remove those so-called tooth-like structures. But then why do those signs come in now? The ones I was telling you, the diarrhea, the what? For them, they consider that these are the cardinal indicators that my child has a vinyo. In the process of teething, that child feels itching gums, or that baby feels the gums are trying to itch. So it means the tooth is trying, because for it, I told you the process started from the womb, but then the teeth are continuing to come out, because they have to eventually come out, and you see the child developing teeth. But then, how does it happen? As that process takes place of you feel the teeth are coming, but then you are feeling the gum is itching. It's a normal physiological process, because the gum is supposed to itch. But then, as a mechanism of responding to that, they tend to have that soothing effect by scratching. You get? You see how it is coming in? In doing so, you cannot ascertain the cleanliness of the child's hands, because these children are the ones who can touch anything. People normally say my child was just born, but however much the child is born cannot be sterile to cause any sign of infection in the mouth. Remember, the mouth is just connected to the GIT. You get? From the, you can call it the stomach, you can call it the stomach. But anything that goes to the stomach, just to know it has the final end result of going into the bloodstream. You get? So you have taken in, maybe you have, because even if it's you feel something itching here, you must touch there and scratch, so that you can feel that soothing effect. So in doing so, we have found out that children, in trying to scratch that, they can feel that soothing artist moment. They feel a bit relaxed. So they touch there, they put in whatever we may not know, but depending on whichever ground they have been touching on. So in doing so, they develop those systemic condition, maybe infections, bacteremia, anything that can come in. So they start manifesting by those clinical signs I was telling you about. Those are at least three to four major clinical signs that people normally dwell on, say that my child has a vinyo. What happens then? The child does not get that medical attention, maybe does not go to the hospital. It's, I think like maybe 95%. I think it's only 5 that goes to the hospital to say that maybe my child could have got malaria. My child could have got an infection. But then 95, we find they are going to where? Those traditional dentists you are talking about.
So parents have been convinced that unless you take your child to this traditional person, they'll never heal. They can even die. Should we assume that they die of this infection? And when they go to these, of course, parents come out and testify that when I took my child to this person, after removing or uprooting whatever they do, whatever the procedure is, they are now okay. So what is the chemistry there?
Because I heard that before. Then I asked myself, I think I need to find out more what really transpires. Then I had to engage myself with that local person who does so. Then I was like, but really, how do you deal with such? Because I told her that the nail you are using, I think it's the one you used on the child of the other one. I was like, maybe for you, for her, she was like, I ban it. Maybe you can kill them that way. Then I was like, how about the wounds you have caused? The dirt you have put in someone's mouth, in the fresh wound of the child. It was like, I normally tell them, go to the nearest clinic and you get some antibiotics, some drugs. Maybe I think children are surviving after that I call it post-operative because it's an operation. I think they're surviving that way because we feel most lucky when we meet such children, because we find we initiate them on antibiotics, or we first do diagnostic tests. We do blood smears, we do all the laboratory tests. We confirm if there is an infection. Surprisingly, there's a child they brought me because it was like a debate. some relatives were like, this child will be a vinyo. Don't waste your time. But then, to bring the child, we tested. To my surprise, it was malaria. And it was severe malaria. The child was almost shivering. Like, people used to call it, when the child is, the malaria is too much, and maybe the child is shaking, that thing of shivering too much, then maybe people were like, ebinyo bimuyitirideko, like the ebinyo is becoming too much. So I was like, let's first try. Because remember, it was a debate. It was all about diverting those people's minds that actually it can be a medical condition to be handled. But then, when you settled the child on malaria treatment, the child got better. Then eventually the teeth had to develop under normal circumstances.
So meaning in the modern medicine, for you don't uproot or whatever. You don't subject this child.
That's why even in modern, or what we call modern medicine, when you are studying this, they tell you it is fourth teeth.
Okay.
Fourth, which means it is fourth. It's not true. It's not true. And there's nothing you can discuss about something that is false, except transforming people's ideas that actually what you hear about. Because when you hear like evinyo, it sounds true, but when you put it in English, you find it's exactly false. Because if you find that something you are calling true in your local language, maybe evinyo, but then you go to the dictionary, they tell that this what you are calling true evinyo, but it's called fourth teeth. You get, which means you are trying to do more harm than good to our children, which it's a practice that we really do condemn, because we find that those children that they do normally extract those teeth, you find they get development problems of these. They know I made research and I found out they normally remove these teeth, anterior teeth, canine to canine. So you find that people are getting problems with teeth formation, mostly permanent, because they are removing those teeth. Those tooth buds, like where the teeth develop from, they are the ones that are uproot. So you find that the other teeth that are coming from down are losing or are lacking orientation. Just come anywhere they want. Some people fail to come in that position. Find someone is having a natural gap and is okay with it, but then the child is literally doesn't know about how it came about, but then the parents caused that. You get it? Yeah. So I think that one, we can leave it at that.
Before we go for the break, we've also seen parents who come to dentists and request you to remove the child's milk teeth before time. So probably they don't like the shape or the color.
Yeah.
And they tell, please remove them before. What are the effects that come with that?
Okay, the effects are the same as, when I was explaining this point of people who tend to neglect the care of milk teeth. You get? Because when you tend to neglect the care of the milk teeth, it means this child is going to face, in fact, the most affected teeth are these upper teeth. If you see those children, however much other teeth can get affected by these upper front teeth. Reason being, we found out that most syrups are sweet. Why are they sweet? Just because they put that sugary coating so that they cannot get sour to our kids. But then, why I was telling you about like neglecting the care of the oral care of these children, you tend not to clean. People say, should I even buy a toothbrush for a child? For what? Even the old people, most of them don't have. So why should the child get? So back to what you asked me about, people come, they ask us that we should remove those teeth. I think that was last week, but I got such a client. They even made an appointment. I was like, I'm bringing my child to your facility. I want you to extract like 3 teeth. In my head I was like, the 3 teeth are shaking at the same time. I was like, maybe let me wait. But coming, the teeth are not shaking. They are not painful, but they are discolored. The discoloration is being caused by the teeth decay or the dental caries. Reason being, the dental caries just come because of poor oral hygiene. You don't care about your teeth, you don't clean them, they get sick. So I advise the mother that these teeth are actually keeping the position of the permanent teeth that are coming underneath. So the solution was, because we have cements we do cement those teeth. Because people think that maybe those teeth cannot be worked upon. We can decide to put for you a temporary cement so that temporary cement can stay there until that milk tooth starts to shake normally. It means that physiologically the root has resolved or the root has decayed, which is normal in milk teeth. So as the root resolves or as the root gets decayed physiologically or normally under normal circumstances, the other one is coming. So that's why you find you cannot extract a milk tooth or move a milk tooth and you find it has a root. So they're always rootless. It means the root has decomposed or has been absorbed, and then eventually just get it out.
Okay. Well, we are taking a short commercial break. When we return, we continue with the conversation, especially about myths and the misconceptions that surround dental cavities, dental health, generally dental health. We are coming back shortly. Stick with us. Welcome back from the break. This is Family Hour, empowering families one episode at a time. And of course, today we are looking at, we are demystifying dental myths. And before the break, we looked at a number of them, including the false teeth, but also we looked at what people look at, especially as they fail to take care of the milk teeth of their babies or their children, and what comes then if you neglect that, but also the solutions available. Now we want to go to now the old people. Someone has their permanent teeth. There are a lot of things you were talking about, whitening of the teeth, and this is something that is so common of late. Everyone wants to have the white teeth. So, what are the myths that are associated with whitening of the teeth?
Okay, thank you so much, Mr. Edwin. It's also another, because I wanted to bring it on just because you brought in what was most haunting, the other avenue.
Yes.
But then the people have always, because for us we call it cosmetic dentistry or bleaching of teeth to make them white. Just like maybe I could be dark skin, but I want to appear maybe brown. I will use something, or maybe a chemical, or some maybe like a visible to make myself what? Make myself maybe brown. So the same applies to people are thinking that white teeth are the normal or healthy teeth.
Yes.
Which is also a myth, obviously.
But I think they also look a little more beautiful on someone's face.
We are not. That's why I was like, it's cosmetic dentistry.
Okay.
And then we are trying to deviate from the normal. If you are going to cosmetics. But then, what am I trying to bring out? The teeth are not supposed to be pure entirely white.
Yeah.
Why do they change that color? Oh, the normal color is supposed to be slightly yellowish. Where do they get that yellow color? Because you realize the tooth parts, the outermost part is supposed to be white. That's the enamel. But now how does it come about to come with that yellowish background or yellowish shade? Slightly yellowish shade. You realize last time we were here trying to break down the parts of the tooth, how it's from up, middle, inside. So just underneath that part of what I was talking about was this part of the what you normally see. This white outer part is the enamel. When you open your mouth like this, what you normally see. But then underneath, this is just white because it's a model. But then we are looking at health normal teeth. But then underneath this part, or underneath this enamel, it's the dentin, and the dentin is pure yellow.
Okay.
You get? So that yellow coloration of the dentin underneath the enamel part of the tooth gives it a slightly yellowish shade. So what do we do when you come maybe for you want whitening? We are not going to refuse because I told you it's cosmetic. And because we are living in a changing world, people want to appear the way they want to. You get? We make them white, they just become white like this. But what we do, we come and we apply our bleaching agents, chemicals, whatever we can use, so that we can do what? Have your teeth happen whiter than they are supposed to appear. But then it also comes with the other effects. Because you are you are tampering with the normal structure of the enamel or the normal outer looking of the tooth. So that's basically a myth. People should understand that the teeth are not supposed to be entirely white. If you find your teeth having that yellowish color, it's okay. However much, what people must understand also is like this. God created us in a very unique way. You find the light-skinned or the brown, I can call them brown, light-skinned people having the teeth color which are more yellowish. Call them, those ones are graded into shades when it comes into dentistry. But then the dark-skinned, if you have been able to be observant, you find them with their teeth are more white than us, maybe or you who are brown. But then you find people have failed to identify that. Someone is light-skinned, sees someone who is dark-skinned with more white teeth, then he was like, I need to visit the dentist. But then that's not an abnormality. It is something that you should just appreciate. It's just like being born when you are short, but then you are trying to say, why me? Why can't I become tall? You're just trying to change what God created you in.
Okay.
Yeah. So that's basically also another important myth that people have been trying to put on.
But now the people in dental facilities promote this myth, because when someone comes, they want to whiten their teeth. Why don't you encourage them to? Why do you go on to apply bleaching stuff and
I think what is now changing the trend is the money thing. This is something that I just want us to acknowledge, because at least you try to advise the patient. But now I want you to put that debate now. You are trying to advise. You have not yet paid rent. You get? Which is totally
you
something.
You have to take your children back to school.
Yeah, that is totally something that is changing into something that is deviating from our oral health promotion campaign. But then it's not something that I would recommend that if you have yellowish teeth, go to the dentist and make them white. Unless you feel, having understood what I have explained, I still want to make my teeth white. That's why I told you it is more of cosmetic dentistry. Okay. Someone tells you I want to put this, maybe my teeth, make them more brighter. Eventually serving the patient's needs.
So
but then you find
what are the effects that come with that after whitening my teeth? Are there any side effects that come along?
I wouldn't call it the best procedure I would recommend for you. Reason being, people have always complained about sensitivity. Why is sensitivity coming in? Because I told you last time we were discussing about the most sensitive part of the tooth as the dentin, and the dentin is just underneath the enamel, which is this outermost part. So when you interfere with the outermost part, because I told you we are trying to breach, like trying to apply a chemical on that outer surface of the teeth. So it means as you are breaching it, you are tampering with the structure outermost, covering the most sensitive part, which is the dentin. So it has been always a general complaint among most patients who do that teeth whitening procedure that I've had several times experiencing that tooth sensitivity. You get? So that is if you have ever happened to have a sensitive tooth, you know how it feels. Taking something cold, something hot, you feel that total discomfort. The other thing, it's not a permanent solution. After some maybe 4 or 5 years, you need to again put in. Another disadvantage that I would like to bring out, it's very expensive. Very expensive, because at least at what I've seen, most clinics, you find it's being done at around 1M, 800,000, whereby you find it's not a permanent solution. You need to, again, have it done maybe after like 4 years, 3 years, depending on how maybe your oral hygiene. But then it's something that I wouldn't wish really to recommend. If the teeth change color, reason being maybe you are not caring for the teeth very well, that's understandable. What you do, you don't do whitening. Instead, you come, we do teeth cleaning and polishing. Because the teeth have changed the color, maybe they have those extrinsic stains, maybe you have been smoking, maybe you didn't brush your teeth very well, the food particles have gotten attached to the teeth surfaces. Thereby, you can go to the dentist and they do polishing and cleaning. That's what I would recommend anyway. Because most people you have brought it, but then I'm remembering this thing. People come in and they tell that, Musawa, I would like to whiten my teeth. But then you ask why whitening? That there are something that are stuck on my teeth. Then you realize that now that's the person that needs what? That needs our advice. We normally advise those people to go for scaling and polishing. That's whereby you do professionally remove those hard substances that cannot be removed by a mere what? Toothbrush. So basically that's it about whitening. Then maybe before we leave those myths, there is also another important thing that people believe that we lose teeth by age. People believe that it's okay to have no tooth in your mouth by the age of 60. Have you heard about that before?
60 is even too much. At 50, so at 50, someone...
those are the things that really...
50 at least.
Whenever someone mentions such a statement, I feel like crying. Because you first of all, I first weigh the importance of teeth in our oral cavity. You're smiling, you're eating, we live because we eat. If you don't eat, you cannot live more longer. But then you find someone telling you that, me at least I'm okay. 50, I still have the front teeth. He has already forgotten about the other behind teeth. But then you realize the moment you don't care about your teeth, there is a possibility of you losing even those teeth at the age of 20. We found the extractions. Someone comes, maybe cannot manage, maybe these procedures like root canal or what. The only solution is removing. Then you find you are removing a tooth, but then you ask, where did the other go? Me, I lost them because they were sick or what. Someone is at 24, but then you imagine what will happen by the time that person comes to maybe 55. It means people are still believing that it's normal to extract a tooth. That's why we normally get time and we come and explain really the advantages of looking or taking care about your teeth.
These days actually, the dentists have also advanced their artworks. Gone are the days where you would see, for example, dental clinic and then in brackets, omukuzi wa manyo. And so that was the mind. Each time I'm coming to a dentist, I'm going to omukuzi wa manyo. In other words, the only solution I expect from you is
actually for you say that maybe they have tried advanced.
These days they say omusawa wa manyo.
But that one is now more in urban areas. But it's quite absurd that in deep villages where we come from, you find there are those people who are specialized in extraction. You tell him or her about cementing a tooth or restoring a tooth, tells you, let's remove. It's quite absurd, but that's why we are trying to get out from people's minds that whenever we get a chance, at least maybe in the churches, in public gatherings, we try to educate them about the importance of people even don't know that even it is possible to restore a tooth that is painful. That's another funny bit of it, why people end up removing the teeth. But then it's quite absurd. The other thing is I wanted to bring out was people who are pregnant. Pregnant mothers. We have always had challenges that for them, someone gets a painful tooth when he's 2 months pregnant. But then someone says, they told me that I cannot visit a dentist until I give birth. It is totally too wrong. That's why I told you that it's a widely spread false belief based on misinformation. Because now imagine you're pregnant, someone is pregnant, but then has to wait until 9 months. 9 months with pain. Pain can lead to shock. There are other complications of a painful tooth. You can find someone maybe a jaw is swollen or what. other complications coming in. But then what we normally advise them, because I tried to engage with them and I found trying to find out what do they think that we shouldn't go there. Because some of them are saying maybe they told us that the drugs they used can maybe affect our babies or what they are pregnant. Then the gist of the matter is always like when you receive a pregnant mother, identify at which maybe period each trimester is the pregnant mother on. You measure the vitals, that is mostly the blood pressure. Having determined maybe all those general condition of the patient or the pregnant mother, it can guide you on which medication you are supposed to use. Just like the way you can be treating the maybe hypertensive patient, a diabetic patient, there are precautions you have to take as a dentist. But then the mother will not know until he or she has joined has visited the dentist and the professional dentist, because that's why you're finding that mothers are just there. Because you realize that maybe after delivering, that's when most tend to visit the dentist. Yeah. But then you find that the tooth that maybe just started maybe having the tooth decay at around 2 months. By the time the patient or the mother visits after delivery, maybe the tooth, she cannot do anything about the tooth. It has already worth. So, I think that's something that we should also really try to bring out. Okay. And before, I wanted us to...
actually, it's what I was going to say, that we cannot talk about myths and we forget talking about the brushing. There are a lot of myths that are associated with brushing and toothbrush, which toothbrush, and then what, those things. And I'm glad you have a toothbrush with you here. Probably it could be helpful in especially knowing which kind of toothbrush that someone needs.
Yeah. Starting from that, there is another important myth I had also prepared about toothbrushing. Okay. People, we still do believe, our viewers out there, we still do believe that brushing hard is brushing nice.
Exactly.
Because someone, maybe to take just an example, someone believes like over scratching the teeth surfaces, actually, you are doing more good.
And at some point, you're even nodding your head as if you're dancing to a rhythm.
Sometime I was passing by some corridor of a neighbor. But then I heard, pass by the window, but you heard someone that surely someone is brushing. Why? That sound was even coming like, quack, quack. You see, that was something. Because you see, how I had to carry this model is the reason was, show you at least different parts, or how the same way the teeth are arranged here, it's just the same way your teeth are arranged in the oral cavity. Okay. You get? So why was I saying that brushing hard is not brushing nice? God arranged our gum, ebibun, and then pressed in the teeth. But then you find that when you're brushing too hard, you are trying to disorganize the arrangement of the gum. That's why people who brush the teeth so hard, you are likely to find the gums are detaching. Find that you're almost seeing the tooth root. You get? It means you are using a wrong technique. And then another mistake we normally make, if you can dear viewers, if you can just focus your eyes on my toothbrush, you realize it is soft bristled. The bristles are too soft. Which means these bristles were meant, or the manufacturer manufactured them, to remove the immediate food that you have just eaten. Not the food that got stuck on the teeth surfaces a year ago. Are you understanding my point? Yeah. Our dear viewers, why we normally encourage you to buy this soft bristled toothbrush. Soft bristles, I mean where we put our toothpaste, the surface that attaches all that we use to clean. That's why I'm like, always use this soft bristled. And why are we using soft bristled? Because we are trying to remove the food we have just eaten. There are some things I wanted us to talk about. How best can we clean our teeth? Because that's also another important thing that I would never miss when I'm in maybe something like in a public health address or oral health. So, dear viewers, I wanted us to understand that we must tackle at least 3 objectives in this oral health care. There are something that we must understand. That the first thing is when should we brush? Another important thing is how should we brush? How should we brush our teeth? Then another very last key point is what should we use to brush? Let's start with that, because we have already seen we should not use the very hard toothbrush, and then we should use toothpaste. Toothpaste, we just put I've always recommended, or what is recommended is a pea size. You know, a pea cow. A pea size. Because we have a tendency of people
Some
putting
people just
from here.
feel the entire bristle.
That's we are just here anyway. You keep putting that until you have maybe someone has told you, but then we cannot blame. But now we blame that person who has had, but then still continues. Because first of all, the most disadvantage about it is that you use the toothpaste so fast. It will go so fast, even around the side effects or what. But then you find yourself that maybe in a family you are buying toothpaste almost every day, or or like every week or a month, which whereby you would use a toothpaste maybe for 2 months, but it's doing the purpose. Yeah, so that you have understood you have to use a toothpaste and then toothbrush. At least that one we have understood that. But then this one, when I say toothbrush and the toothpaste, I'm removing all other myth. Maybe using a stick, chalk, all these things are left behind.
Ash, salt.
See, if you had maybe opened maybe online calls, people to call, the first question would come, what if I use my sticks? You get those things that we are just outlining them, so that means that the first objective is answered. What do we need to use? But then another thing we are now looking at, when do we need to brush? Because those are the key things. If you answer that aspect of when do we need to, it means you remove the other things I was telling you about food getting stuck. We normally recommend 2 times in a day. That's in the morning after taking breakfast, at the night when you're going to sleep. Just as simple as that. When I say that, I just want to remove all those other questions. I must remove. People normally say, what if I get a visitor in the morning when I've not brushed? If you get a visitor in the morning when you have not brushed, yet you brushed at night when you are going to sleep, it means you are likely to wake up with a fresh oral cavity. So even if you get a visitor, you are free because you remember you brushed at night, and I don't believe that you had to eat anything during the course of the night. So that question is answered. Why the brush in the morning after breakfast? Because I told you these bristles, they remove the food that is fresh. You have just eaten on the two surfaces. The food you have just taken after breakfast, you remove it with a toothbrush. Then you eat your lunch. You can just rinse with water. But preparing the oral cavity or the mouth in the evening, when you are done with eating, maybe you drink porridge, taking those who take maybe alcohol or whatever you're supposed to take in the mouth, you're done. You're going to sleep, you're going to do what? Brush. I do think that one is very clear to our dear viewers. Now then, the one more thing what people are waiting for is how do I do my brushing? Now this one is the most tricky thing, because we have found people are doing like this. They come and they shake. They use whatever movement they feel like. Because someone enters goes to the sink or gets outside to brush the teeth, but within 2 minutes someone is done. It means that person is doing an improper thing. Surely, 2 minutes you are done with brushing. How many teeth are you having in your oral cavity? You get, because we realize today we are a bit practical because we have been coming here, but then trying to be more theoretical. But now we realize that this is like an oral cavity. Or this is your entire mouth when you open like this. Just because this model lacks a tongue. But then we're just going to put our focus on the teeth. In fact, these are the upper teeth. When you're supposed to start brushing when the teeth are like this. When you put your toothbrush like this on the teeth surfaces, you realize it can come to around 3 teeth. You get? So when you touch it, because I believe you have already put the other pea-sized toothpaste. Yes. You have put it on the brush, and then you have put on running water, then you are coming on. Now start brushing. Let's start brushing when the teeth are closed like this. Okay. You get? Maybe you can decide to start with the behind or posterior teeth. You have attached I told you the toothbrush can accommodate 3 to 2 teeth. Whichever number you have attached on, the movement you are following is a circular. Circular movement. It's no longer this way, but rather this way now, round and gentle. You are moving the other effect of rough. Let it be gentle, like this. And we are focusing on the principle of 10 times. If you are doing like this, let it be 1, 2, 3 until you reach 10. Just simple as that. It doesn't even take a full minute. 1, 2 until you reach 10. You come. until you reach this side. You come. Because remember your teeth are closed.
Yes.
Just be gentle enough for that technique of 10 times. Whichever the number of teeth you come across, just do 10 times. You get? Then now you have opened your mouth. If you open your mouth, you realize like the teeth are appearing different. Our dear viewers, I've brought this model so that we can really appreciate what we have been always talking about theoretically. Now you have come into contact with, like you have come to clean your innermost part of the teeth. We have been on outermost, doing that for sutural motion until the end. But now you have opened your oral cavity or you have opened your mouth. You realize these posterior or behind the teeth, they have grooves or they are not that straight.
Yeah.
They have something, we can call them holes. So using the same toothbrush, you just follow. Now you are not following the sutural motion. You are following front, back, forth. Front, back. The principle is 10 times. Don't do like this. I'm done. 10 times you are doing the other side. Now do it this side. 1, 2, 3 until you reach 10. Now leave that side because you realize the teeth that are this side are the same as this side.
Yeah.
The shape in everything, even the side, the upper side. What you did here, don't do it here, but rather do it from the posterior teeth of this side. Again, turn and do the same thing on the posterior. I think our dear viewers are able to see it clearly.
Yeah.
The 10 times principle. Come again this side and follow the same procedure. Now you realize there are teeth surfaces that are left out,
Yes.
like these front teeth down. The way they are just arranged, just follow the same order. 10 times principle.
Okay.
And it should be gentle as much as possible because you are removing the food you have just
the
eaten.
other pea size paste still enough, or
It's
I'm
still
allowed
enough.
to still add some more?
No, along the way you should never add another toothpaste because you realize when you put in water and then you first start put on the tooth surfaces, it's producing that foam,
Okay.
which is enough because you're just considering the fluoride content within that toothpaste.
Okay.
So you do 10 times. You see how I'm bringing from inside towards outside. I'm able to remove the dirt without damaging the gum. The same applies when I come to this side up. Still do the same 10 times, but now pulling from inside outwards. By doing so, I'm doing it gently in a way that I will not damage the gum inside or neither the gum outside. You get? So you realize that by doing that you are not yet done because you realize there is another important part. This side of the posterior teeth, but move inside. The other time we are outside, so what you literally did outside, come and do it from inside. Sutura, we are coming back to the sutura motion.
Yes.
Sutura until, because this side you already done, you come this side, the same applies this side and this side. But now, people normally tend to say that maybe that's enough. But now realize that what is remaining now is the tongue. This model, unfortunately, it doesn't have a tongue, but I'm just going to use this. At least people can easily identify that this one, at least this is the position of the tongue.
Yes.
You just put it the same way you are cleaning these teeth, front teeth. Just come and clean the tongue like this. From inside, don't go towards don't put the toothbrush towards the throat. You eventually feel like you feel like vomiting. But then, our dear viewers, whenever you feel like vomiting, don't touch feel like don't touch caca. Yeah? First pause a bit, maybe take a breath, and then you again. Cause don't just ignore because you feel like vomiting. Because there is a vomiting reflex that you stimulate whenever you go behind. So just do it gently. I think you can also follow 10 times principle.
Okay.
Because most people tell them to open the mouth. Yes, you find the teeth are clean, but then the tongue is, because that's the common thing that causes bad odor.
I see our time is actually well spent, but I think it was worth it. In a minute, what are your closing remarks, especially on the message you've just shared with us?
Thank you. Maybe just like a simple minute, maybe just 1 minute. There's something I just also brought for the audio viewers. There are these things called dental flosses, which we must, because you realize when you take maybe like a mango or meat, you normally use toothpicks. Toothpicks have been found like they damage also the gum. Feel free to buy this. The whole packet is just like 3,000, but containing 30 of them. feel free. That's that not every day, but that moment whereby you have been feeling like you want to put a floss. I mean, to use a toothpick. Just use this. It's thread in nature. In between the teeth, you find by doing like this, it's removing the particles in between. You see, audio viewers, I think you can see clearly. Then maybe one more last thing I wanted to tell our dear viewers, people who have been maybe complaining that the dental maybe is expensive or what. We have always organized dental camps, free dental camps. For instance, we have there's something that we are organizing in Chitoro Entebbe. Yeah, we have organized a camp which is 27th and 28th this very month. People that just come, we receive at least free services. We have been complaining that dental is expensive, procedures are expensive, but at least let's always have that positive oral health seeking behavior. Then maybe as I conclude, I'm very sure my staff members at Rafa Medical and Dental Services, when you don't say hello to them, they always, when I reach there, they try to say, hey, Musao, you didn't tap on us. It's Musao Joan, Musao Emma, Musao Lawrence, then maybe Madame Joanna. They are there watching us, and they are really trying to do some good work in trying to promote oral health. I think.
And greetings to them. I've also to thank you as well. Adrian Austin Mkazi is my name. I've worked with Ivan, I've worked with Emma, and the entire team. We wish you a blessed night. Goodbye.